Thank you all so much for joining us today for our virtual information session for the Master's Science and Health Science program. My name is Ana Chapa. I'm a senior graduate student recruiter here at UTRGV, and joining me today are faculty from the MSHS program. We have Dr. Forman, Dr. Gadar, Dr. Wendt, and Dr. Hawes joining us today. Thank you all so much for being here to share your knowledge, your expertise on this program and the various concentrations that are offered within it. Now, a little bit about what we'll cover today. We're going to give you a little bit of history on UTRGV, talk to you about why UTRGV is a good fit for you, maybe the best option for you as you pursue your graduate studies. We're going to give you program information. Faculty from the program are going to share detailed information about the program itself. We're going to walk you through the application process, discuss funding opportunities, and then at the end, we will take your questions. You are more than welcome to send your questions at any point throughout the presentation. You'll see an option on the menu to submit questions. You can send them in. I encourage you to send them in at any point throughout the presentation as you think of them. That way you don't forget them. But we will answer them at the end of today's presentation. Now, a little bit about UTRGV. UTRGV has 98 years of storied educational history. So although UTRGV itself was established in 2015, and we're actually celebrating our 10th anniversary, we're very, very proud and very excited of everything that we have accomplished in those 10 years. Our history actually goes all the way back to 1927 with our legacy institution, University of Texas Pan American, and our legacy institution, UT Brownsville, which was founded several years after that. We have a growing graduate student body with 35,487 students, over 4,000 of those being graduate students. And you can pursue your graduate education with confidence and peace of mind at UTRGV, knowing that we are accredited by SAC-COC. Now, as I mentioned, we are celebrating our 10th anniversary, and we're very, very proud of everything that we have been able to accomplish in those 10 years. UTRGV is consistently ranking very competitively in terms of value for our students, in terms of return on investment for our students. UTRGV was ranked #1 university in Texas by Washington Monthly 3 years in a row. So we're very, very excited about that. And I'll go ahead and place a link in the chat for everyone. The link is utrgv.edu/rankings. If you want to take a deeper look into the methodologies used to determine these rankings and review other accomplishments and recognitions that we have received over the years, you can view those there. Now, when you pursue a program like the Master's Science and Health Science program at UTRGV, this is what you can expect. This particular program that we are discussing today is an accelerated online program. This means that the program is 100% online. It runs on 6 modules per year rather than the traditional 16-week semesters that you might be used to. Each module is 7 weeks long. Full-time enrollment in an accelerated program is 6 credit hours per module, and part-time enrollment is 3 credit hours per module. As I mentioned, it's 100% online, and it is asynchronous, meaning that there are no scheduled lectures or assigned meeting times. So it really gives you that flexibility, especially for students who have schedules that require that flexibility. Maybe you're working, maybe you have family commitments. This can be a really great option for a flexible schedule. Now, this program is designed to be completed in as little as 12 months. And this is dependent on you taking those 6 credit hours or being enrolled full-time in the program. And if you have any questions about that timeline, please feel free to send them in the chat. And with that said, I'll go ahead and give the floor to Dr. Forman to give us an overview of the program.
Thank you for that introduction. We're going to be talking a little bit about the MSHS program. That's the abbreviation we use for it in general. And then Dr. Gadar, Dr. Wendt, and Dr. Hawes are going to be speaking about some specifics about the courses and the different concentrations. The unique thing about the University of Texas Rio Grande Valley MSHS program is that it is interdisciplinary in nature, and it's a really unique way to learn, because all of the core courses that Dr. Gadar is going to talk to you about, the students from all different kinds of concentrations and all kinds of healthcare professional backgrounds are enrolled in those courses together. And then you'll take concentration courses that are specific to your content area. The 5 concentrations that we have in the MSHS program right now are healthcare administration, clinical laboratory sciences, nutrition, healthcare informatics, and health professions, education, and technology. We also, in the College of Health Professions, we also offer certificate programs for clinical laboratory sciences, nutrition, healthcare informatics, and health professions, education, and technology. And what a certificate program is that it would not be a complete master's program. It would be focused studies, just the 6 concentration courses. So who is this program for? What kind of student does this program work for? As it says, it's an accelerated online program, which means fast track success. You can complete this program in 1 calendar year if you take the 2 courses per module. It really works well for working professionals who are balancing school, work, life, and the student who wants a lot of flexibility and a lot of structure. The asynchronous nature of the program means that you can do it on your own time. The other unique thing about this program is that you can start the program 6 times a year. You can start in fall module 1, which begins in mid-August. You can start in fall module 2, which begins in late October. You can start in spring module 1, which begins in early January. Or you can start in spring module 2, which is this upcoming module that will begin on March the 2nd. So late February, early March, depending on the calendar schedule. This year, spring module 1 begins on March the 2nd. The summer module 1 starts in late April, early May, and summer module 2 starts in late June. So you can start the program at any one of those times per year. And as was said, it's flexible enrollment. If you take 2 courses per module, you're going to complete the program in a year. That's considered full-time. If you take 1 course per module, you're going to complete the program in 2 years, and that's considered part-time enrollment. Okay, I'm going to turn it over to Dr. Gadar now, and she's going to talk to you about the core courses and the healthcare administration concentration.
Thank you, Dr. Forman. So the MSHS core courses, these are 6 courses. 1 of each is offered every module. So every module you will take 1 core course and 1 concentration course. These courses cover foundational material that cuts across all the concentrations. So we cover issues that are related to legal and ethical issues in healthcare, healthcare policy, organization, and financing. You also learn how to professionally write proposals, how to evaluate research in the health sciences, and critically appraise that research to support evidence-based practice. And also there are courses that cover healthcare systems and quality and health computer information systems. What is, again, as Dr. Forman mentioned, since everyone, whichever concentration they are from, is taking these core courses, you're really going to be in a unique learning environment that is interprofessional in nature and interdisciplinary in nature. So you get to interact with other students who come from different backgrounds and different disciplines. The first concentration in the MSHS program is the healthcare administration concentration. And this concentration is offered in collaboration between the College of Health Professions and the Robert C. Bakker College of Business and Entrepreneurship. You do get courses in that concentration that really prepares you to lead health systems and healthcare organizations. You take courses in management, in finance, in accounting, as relevant to the healthcare environment. You also address certain legal issues that are particular to health systems and quality management issues as well. You get networking opportunities with other healthcare leaders during the program. And in terms of the admissions requirement, the additional requirement is related to having some health-related experience, whether through a bachelor's degree in a health-related field or through a healthcare work experience. So any work experience in a healthcare setting can also serve to meet that additional admission requirement. Next is
Hi.
Dr.
Thank you for that. Hi, everybody. I'm Dr. Wendt. I am the primary faculty member for the clinical lab science concentration in the MSHS. And this is a really good program for people who have been working in the field. As this says on this slide, this is not an entry to practice master's program. There are master's programs like that out there in the United States. San Antonio has one, for example. That's not what this is. So this is geared towards those of you who are already registered medical technologist or medical lab scientist. And it can be people who have just recently graduated with their undergraduate degree, or it might be people who are middle or even late career. I've seen it all. And it's a very flexible program, as Dr. Forman was saying. This is easy for people who work all shifts to juggle in their personal lives. So if you do night shift and you have a family, no problem. You'll have a lot of classmates who are facing the same tasks and struggles. So this concentration, in addition to all of the core courses that Dr. Goddard discussed, you will be focusing on advanced topics in hematology, clinical chemistry, immunology and infectious diseases, and you will also be getting a well-rounded introduction and refresher in pathophysiology. So not only is this a useful degree for those of you who want to rise up in management or supervisory roles, or even becoming a laboratory director, this is perfect for that, of course. But for those of you who are aware that there are new advanced practice doctorate programs in clinical lab science, this is also a great way to strengthen your application if you have this, just to make you that much more competitive. And I speak from personal experience because I actually went through this program myself a few years ago, and it was instrumental in getting me into the UTMB DCLS program. So again, highly flexible. You finish quickly in a year or two if you're part-time. And I feel like you can't get more bang for your buck in this program. Thank you. And I'll be turning it over now to Dr. Hawes.
Hi, thank you for that. So I'm Dr. Hausen. Our focus will be on the nutrition concentration within the MSHS. So this is actually the first and only accelerated nutrition program online where you can complete the entire master's within a year. All the other nutrition programs within the nation are generally 2 years long and have 4 to 6 different semesters within them. It is designed very similarly to the lab science, where it is meant for those working in the field of nutrition. So those that are dietitians already, health teachers, coaches, or personal trainers, even those with exercise physiology or other healthcare professionals. This program is specifically useful for those that are dietitians that are looking to get that master's, as the new requirements to be a dietitian require master's. So you can stay competitive within the workspace, even if you've already been practicing for 10 plus years. The additional admission requirements are that you do have anatomy and physiology coursework coming in, which most of the people working in some sort of healthcare field already have. And we recommend to have anatomy and physiology more than just one course, at least 2 be helpful, but 1 does suffice to get you through. And there's 3 hours of undergrad nutritional coursework as well that is recommended. There's also a graduate certificate available for the nutrition concentration. The nutrition concentration in general will be going from all different components. We'll look at pathophysiology, disease, and chronic health and nutrition, down to very specific things like diabetes, eating disorders, and integrative health, and even some biomechanical and biochemistry type of practices within nutrition.
Okay,
Thanks,
thank you,
Dr. Haas. I am going to talk about the healthcare informatics concentration now. The healthcare informatics concentration is one of the 5 concentrations, and it's really designed for the student who wants to learn more about healthcare data and decision making. If you're a healthcare professional currently working in a clinic or an institution of some kind, and you want to know more about how that healthcare data is used to make decisions to improve patient outcome, this is the program for you. Currently enrolled students in the healthcare informatics concentration include nurses, allied health professionals, public health practitioners, healthcare administrators. I think we even have a couple of pharmacists in the program. They're all professionals who are working with patients directly or want to work with patients. We prepare graduates in this program to manage, evaluate, and use healthcare data to support informed clinical, operational, and strategic decisions across healthcare settings. We encourage those applicants to have experience with health records. It's really helpful because we try to work with, real world kind of situations, healthcare data in the program. And it's especially well suited for professionals seeking roles in healthcare informatics, quality improvement, population health, clinical decision support, or leadership. It also, as we've said, it supports those who are working professionals who are looking to advance their careers without stepping away from the workforce to complete a 2 or 3 year master's program. If you're a student who wants a more flexible or targeted option, you're interested in just healthcare informatics and you don't want to get the whole master's program, we also offer a graduate certificate which provides focused training in just those 6 healthcare informatics concentration courses. Okay, next we're going to be talking about the health professions and education technology concentration. This concentration is much like the healthcare administration in that it is offered in conjunction with the Department of Health and Biomedical Sciences and the Department of Health and Human Sciences. This concentration leans heavily into educational theory, and it's for working professionals who want to strengthen their roles as health educators or health trainers in community-based settings. While it's grounded in the health sciences, it really leans into educational theory and educational technology. The coursework students are students are immersed in health science theory, pedagogy, learning how people learn, learning how knowledge is constructed, and how instruction can be designed to support meaningful and measurable outcomes. There is also focus on applying evidence-based teaching and program evaluation. This concentration is intended for allied health or healthcare professionals, public health practitioners who are interested in community-based teaching and program oversight. It prepares graduates who formalize their educational expertise and leverage technology to enhance learning across community educational settings.
All right. Thank you so much, Dr. Forman. Thank you to the rest of the faculty for sharing your expertise on the various concentrations for the MSHS program. I'm going to now walk everyone through very quickly the application process. As you can see, it's fairly straightforward. The various concentrations are going to have slightly different admissions requirements, but we're going to look at the general admissions requirements here. Now, the application process is going to take place 100% online, so you don't have to worry about coming to an office to turn in paperwork in person. You can do everything from the comfort of your home. There is no application fee at this time for this program, so you really are just investing your time and your energy into submitting an application. We are going to ask that you submit all of your academic transcripts. Now, a note about transcripts. When you start your application, you're going to see an option to upload your own copies of your transcripts. We highly recommend doing this if you do have copies of your transcripts. these are going to be considered unofficial. If you submit them yourself through the application portal, they will be considered unofficial copies, but they are still very helpful in allowing us to process your application in a timely manner, and allows for the preliminary review of your application. We will still require the official transcripts to come in, and a transcript is considered official when it is sent directly from your original institution to UTRGV. Now, if we have any UTRGV alumni listening in or watching us today, you don't have to worry about sending in UTRGV transcripts because we already have those on file for you. So we will add those to your application as long as you list UTRGV as one of your undergraduate schools. If you attended any other schools after you attended UTRGV, then you will need to request those transcripts, but just a note for our alumni. Now, this program also requires a minimum 3.0 GPA. However, your application will be considered holistically, and I don't know if anyone wants to say anything else about that, but don't let a slightly lower GPA turn you away from applying to this program, because the program does have the option, on a case-by-case basis to offer conditional admission to students. And if you have any questions about that, you can reach out and I can provide clarification on that. You will also need to submit 2 letters of recommendation and a letter of intent. Letters of recommendation, if you have access to professors, those are always going to be, that should be your first priority, to look for faculty that can provide letters of recommendation, or you can provide letters of recommendation from supervisors or professional recommendations. Your letter of intent is going to be a standard essay where you are discussing your professional and academic goals and your reasons for pursuing this particular program. You can describe, the research you've done into the program, why you consider that you are a good fit for the program and the program is a good fit for you. But essentially you are explaining your reasons for pursuing the program and what your goals are with this degree. You can also see on screen the upcoming application cycles. The program is currently accepting applications through spring 2027. So you can already, I believe those are already available, if not through fall 2026. But if you are ready to start soon, you can actually still submit your application for spring module 2. The application deadline is February 25th, with our summer module 1 and summer module 2 deadlines coming up after that. And just to give you an idea of what the application page will look like, when you visit Grad Apply, so it's utrgv.edu/grad apply, you're going to see an apply now option and a login option. If you have previously created an application or started an application, you would use the login option. But if this is your first time creating your account and starting an application, you're going to use the apply now link. That's only for the very, very first time that you are accessing this portal. Every other time, you're going to use the login link for returning users. That will allow you to keep working on your application, check the status of the application, or start a new application. Something that is very important to consider when you are considering graduate programs is cost, your budget, right? How will this program fit into my budget? As we mentioned previously, UTRGV is consistently ranking very competitively in terms of cost and value for our students. Our accelerated online program is no exception to that. As you can see here, the average total program cost is $16,000 with no additional fees, and tuition stays exactly the same regardless of residency. So you can pursue this program from basically anywhere in the world and pay the same price. And $16,000 for a whole master's program is very competitive. Now that we've looked at cost, what are your options for funding your graduate program? The first one is going to be through federal financial aid. If you are eligible for federal financial aid, you can submit your FAFSA application at studentaid.gov. There are going to be a few eligibility requirements that you need to meet. The first one is that you need to be clearly admitted into your program. So all of those admissions requirements that were listed, you need to at least meet the minimum. So for example, the 3.0 GPA, you need to at least be in that 3.0 GPA category. You need to be enrolled in at least 3 credit hours per module. The 6 credit hours per semester only applies to traditional programs. For accelerated programs, it's 3 credit hours per module or term, meaning 1 class, typically 1 class per module. As long as you meet those requirements, you should qualify for aid. You can also look at scholarship opportunities, and there are 2 different places that you can find scholarships as a graduate student at UTRGV. The first one is our general scholarships portal, which is the / apply scholarships page. This is essentially a portal where you can fill out your profile, and then the system will match you to all of the different scholarships that you might be eligible to apply for. So it's a 2-step process. Fill out your profile and then review your matches and apply to each individual scholarship that you're interested in. The second place that you can find scholarships is at our / grad scholarships page. This is where you will find scholarships that are specifically offered by UTRGV to graduate students. So for example, we have 1 scholarship that is only for newly admitted students. You don't have to apply to that one. You just have to meet the eligibility criteria. You know, every academic cycle, we have different things that are being offered. So it's a good idea to review that page at least once per semester to make sure that you're not missing out on any opportunities. Our UTRGV graduate students also review assistantship opportunities. And there are 2 different ways that you can find those. You can contact your faculty advisor for your program to learn about any available assistantship opportunities, or you can visit the careers page to find assistantship opportunities. What an assistantship is, if you're not familiar, is essentially on-campus employment where you work up to 20 hours per week. You could either be doing a teaching assistantship, research assistantship, or a general graduate assistantship, and you receive a stipend, a monthly stipend for your work. It's a great way to offset the costs of tuition and gain some experience that will later on help you in your professional career. And then lastly, we have, of course, external scholarships. If you're aware of any scholarships locally or on other external scholarship sites, you can definitely apply to those. Veteran benefits, we can put you in contact with our Veteran Success Center and our financial aid office to make sure that you are, you know, submitting everything on time and taking advantage of all of the benefits that you qualify for. And then if your employer offers any kind of tuition credit or tuition reimbursement, you definitely want to contact your benefits office to make sure that you are taking advantage of that as well. And this brings us to the end of our presentation. I want to thank everyone for your time and your attention during this presentation. Again, my name is Ana Chapa. I'm based in the Brownsville campus here at UTRGV. My contact information is on screen, and our main graduate recruitment contact information is on screen as well. You can call us, you can text us, you can send us an email. We are more than happy to assist you. Now also have the contact information for our MSHS faculty that you heard from today. If you have questions about the specific concentrations that they discussed, anything that is really more related to being a student in the program, you can definitely reach out to them. If you have questions about, you know, the application process or you need any assistance with that, please reach out to me and I will assist with that. But I'll go ahead and give everyone a few moments to send in any questions that you have. In the meantime, Dr. Forman, Dr. Gadar, Dr. Wendt, Dr. Haas, anything you would like to share before we start wrapping up?
Right. I wanted to just talk a little bit about the conditional application, the conditional admission. You kind of touched on that. So I do encourage everybody, if your GPA is below 3.0, to go ahead and apply. And we evaluate each application holistically. We look at your work experience, we look at your undergraduate degree, we look at your letters of reference and that letter of intent. So don't let that hold you back. Go ahead and apply. And a conditional admission, you're not eligible for financial aid, but you're still can be in the and start the program. You're only not eligible for financial aid. It's my understanding you're only not eligible for financial aid for the first 6 hours, correct?
So yes, you will not be eligible for financial aid during the period that you are under conditional admission, which is typically met by completing 6 credit hours at a 3.0, right? So after that first term where you're under conditional admission, as long as you clear your status, you will be able to receive financial aid. And there are options for students in that position to still offer you some flexibility with, your payment options and things like that. And that's something we can discuss definitely.
Yeah, great. Thanks for that clarification, because I just think that's really important to understand. You can still apply if you have the GPA below the 3.0, and it doesn't mean that you're never eligible for financial aid. It just means that until your conditional admission is lifted. Thanks.
Correct. Yes. Yes. And thank you for that encouragement. I think that is very important because everybody's academic journey is different. And so having that opportunity to have your application reviewed holistically is very important. Now, a question that I know we get a lot is about the letters of recommendation. So some of our students or some of our prospective students apply having maybe been out of school for a few years, and so they no longer are able to contact former professors. Do you have any recommendations or any advice for students who are maybe a little unsure about seeking that letter of recommendation?
Dr. Gadar, could you take this question? I've heard you answer this before.
Okay, so for the letters of recommendation, we fully understand, and from experience, we have a lot of students who have come back to graduate classes, after being in the workforce for 20 plus years. So understandably, these individuals do not have any connections anymore with the faculty who were in their academic career. Supervisors would be the best people that you would ask for letters of recommendations in that case, and probably to focus on you in a professional capacity, on your competencies, your aptitudes, your work ethic. These are the elements that we look for. Definitely, it goes without saying that your friends who cannot speak in a professional capacity, or anyone who can speak on your behalf in a personal capacity, these will not be good people to get letters of recommendations from. Your colleagues would be good, but I think the preference would be to supervisors who can speak on your professionalism and your performance in professional settings.
Excellent. Thank you so much, Dr. Gadar. It looks like that's all the questions that we have for today. I know that a lot of times, you're receiving a lot of information and you're processing a lot of information during these presentations. So please don't hesitate to reach out. My contact information is on screen again. If later today or tomorrow you think of a question, send us a text and we will get right back to you. Okay, I do see one question coming in, actually. Let's see. I have started an application for spring module. However, I would like to be able to change this to summer module 2. Would I need to submit a new application for summer? So yes, if you have started an application for a specific module, you won't be able to change it. There's no way to change the module. You'll just need to start a new application. The good thing is that most of the information that you had entered on your first application will carry over into the next one. So it's a fairly easy process. So yes, I encourage you, if you are needing to change the module, just go ahead and start a new application. And if you need any assistance at all with that, go ahead and reach out to me, please. Okay, I see another question here. For the letter of recommendation, can it be from a supervisor from my work? I work in a laboratory as a as a phlebotomist, would that be acceptable?
Well, I'll go ahead and I'll chime in since I feel like this is my area. It depends if you're going into this with the intention to do the clinical lab science concentration. If you're currently working as a phlebotomist, but you're not certified as a CLS or eligible to be certified as a CLS, then that concentration wouldn't be for you. If, however, you are looking at another concentration, then absolutely your supervisor can. Because they would have some insight as to your professional conduct and the competence that you show in executing your job functions. I did want to just also add, speaking about the CLS concentration, I wanted to explain a little bit more. You don't necessarily have to be ASCP certified, but you have to at least be eligible or have certification in another, with another a certification agency like AMT. Or if you, for example, we just had this recently, a student or an applicant from California who is licensed as a medical lab scientist in California, but not certified with ASCP, that's okay. As long as you have the academic qualifications at the baccalaureate level and you're eligible to be certified, come on board, we'll take you. So, and then the other thing that I, just in general, this is applicable across the board. For those of you who have been out of school for 20 plus years, don't let the online platform scare you. I have seen plenty of students who have been out for a long time and they were initially worried, but our online learning management system is very student and user friendly. So it doesn't take long to get the hang of it. I hope that helped.
Yes, thanks, Dr. Wendt. Could you talk, Dr. Wendt helps me a lot with the clinical laboratory science applicants, and he does a really nice job talking about the letter of intent and to applicants and how you need to be really important to use your own voice. You want to talk a little bit about that, Dr. Wendt?
Sure. So again, don't let the prospect of applying to a graduate program dissuade you. Yes, there is going to be some rigor if you do these classes. This isn't just going to be an easy gimme degree where you just show up and you get the degree. You will have to be able to write, and wherever your weaknesses are, that's what we're here to help you with. We will try to help you become a better writer. Now, we all know that there is artificial intelligence out there, and I think to some extent, different extents, we probably all use it in various and sundry ways, but don't use it to write your application essay. At the very least, if you use it to guide you or give you an outline, that's okay. But don't ask it to type up your whole application essay and then submit it with no changes, because it's very obvious whenever a student uses AI. Please, please, please use your own words. Even if there's a little bit of a language barrier, no problem. It's much better that we see your authentic selves. And I think we just want to all emphasize that.
Thank you. Do you have anything you want to add, Dr. Haas?
I think that was well put. I think putting in your own words, hearing your past and why you're interested in these programs and how it can help you grow in your future is what we're here to do, is to make sure that matches appropriately for your goals.
Thank you.
Well, thank you all so much. Thank you again to the faculty of the MSHS program for sharing your insights. Thank you everyone who attended and everyone who is tuning in after the fact. Again, please, please, please reach out if you need clarification on anything at all. We are here to help. We're here to guide you through the process and make it as painless and as streamlined as possible for you. But thank you all so much for your attention, and we hope everyone has a great day, and we hope to see your application come through. Bye, everyone.